We're showing data this year from the OPTIMUM MUKnine trial. We presented last year primary endpoint outcomes for this trial where we treated patients with ultra-high-risk myeloma or plasma cell leukemia with a quintuplet induction with Dara-CVRd and then an extended consolidation maintenance therapy with Dara-VRd. We noticed very good outcomes, and I think the follow-on is ongoing. We will present more data on the long-term outcome next year, but we noticed that within the first 18 months, unfortunately, about 20% of patients do relapse. We had very comprehensive genetic and gene expression profiling in this trial, so we have leveraged this advantage that we have in OPTIMUM MUKnine to now look for factors that are associated with an early relapse despite this very intensive and innovative treatment approach. We identified factors that are associated with an early relapse. So we particularly found the co-occurrence of 3 or more high-risk markers, so 3 genetic markers and or gene expression profiling to really have an additive effect on the risk of relapse. So these patients that have a combination of these markers are definitely enriched in the group that has an early relapse. So that's quite an interesting finding. We also find a link with deletion 17p to be particularly enriched in all of these features that I've just mentioned. And it's actually striking that other markers that we probably traditionally associate with adverse outcomes such as ISS3 was not really associated with this group of relapse of 18 months, an early relapse group. So we think the significance of these findings is of course important in terms of treatment paradigms are changing. We're seeing at this conference as well that overall for all comers even we are thinking about potentially regimens such as Perseus, which is a late-breaking abstract here. But there is still going to be a group of patients with unmet needs, and we need to address that and particularly identify new strategies moving forward. We think that our work is really playing a role there, particularly because the diagnostics that we're using are applicable in diagnostic laboratories, in theory, worldwide.